This is a review lecture of the coronary artery disease. Coronary artery disease is also known as ischemic heart disease. Coronary artery disease is basically due to the narrowing of the coronary vessels due to atherosclerosis. Before going into the various manifestation of the coronary artery disease, first we go into the risk factor for the coronary artery disease. These are the risk factors for the coronary artery disease. Diabetes mellitus is the most worst risk factor. Diabetics have highest rates of CED, coronary artery disease. Hypertension is the most common risk factor. Positive family history, especially males under 55 years and female under 65 years. Because female, their estrogen and the menstruation is the protective factor for the myocardial infarction. Next is the hyperlipidemia, which increase the risk of the atherosclerosis. Smoking and non-healthy lifestyle, lack of exercise, sedentary lifestyle, fast foods, these are all the contributing factors for the coronary artery disease. The pain due to the coronary artery disease is ischemic pain, and ischemic pain is not change with position, breathing, and its lack chest wall tenderness. Next thing is the various manifestation of the coronary artery disease. These are the various manifestation of the coronary artery disease. Stable angina. Stable angina is due to the fixed stenosis, and it occur at exertion due to the increased O2 demand. And it is relieved at rest or by sublingual nitroglycerin. And the chest pain which occur due to stable angina is duration less than 10 minutes. Unstable angina occur at rest because it is due to the total occlusion of the coronary artery, and the total occlusion of coronary artery take place due to the thrombosis, rupture of atherosclerotic plaque, and hemorrhage. Unstable angina should be differentiated from non-ST segment elevation myocardial infarction. In myocardial infarction, there is increased troponin enzyme and increased CK enzyme. But in case of unstable angina, these enzymes remains normal. Unstable angina and non-ST segment elevation myocardial infarction lack ST segment elevation and pathologic Q wave. Patient of unstable angina should be admitted in hospital. Variant angina is due to the vasospasm of the coronary artery, and this is episodic in nature, classically occur at night. The hallmark is transient ST segment elevation, and it responds to calcium channel blockers and nitrates. Myocardial infarction is basically the necrosis of myocardium. It occurred due to thrombotic lesion. It occur after the thrombotic lesion. Where it occur after the thrombotic lesion when the atherosclerotic lesion are present previously. So the chest pain of the myocardial infarction is often described as elephant standing on chest or the crashing in nature. Myocardial infarction in one third of the patient, it may be asymptomatic, particularly in the post-op patient and elderlies and diabetics.